Hello everyone. Today we will discuss a question related to vancomycin. So this is also a select all that apply question. Let us start. The nurse administers IV vancomycin to a client with a diagnosis of methicillin-resistant Staphylococcus aureus infection (MRSA). Which nursing action are most appropriate? Select all that apply. So while administering vancomycin to an MRSA client, what all are the main thing or what all are the most appropriate thing a nurse should assess and should work for to prevent the expected complications? So that is the question asked here. So we'll see the options. We have 5 options. So first one is assess client for lethargy and decreased deep tendon reflexes. So while reading these options, you might be getting some ideas in which conditions or in what are the situations there will be a decreased deep tendon reflexes. So while reading each options, we should think what is connected to that particular point. So option 2, assess skin for flushing and red rash on face and torso. Then infuse medications over at least 60 minutes. Monitor blood pressure during the infusion. Then observe IV site for every 30 minutes for pain, redness and swelling. So the options are very simple, but we should select what are the correct and most appropriate one. So here the keyword is that most appropriate. So that we should keep in our mind. So before selecting the answer, we'll study some of the aspects related to vancomycin infusion. What are the things we should follow and how to administer, and while administering what are the expected side effects would occur. So these things we should keep in our mind. So the first point that we should take a sample for the trough level just prior to the administration. We know that when we should take the trough and peak level of vancomycin. Then the normal range of vancomycin in a stable patient, that is between 10 and 20 mg per liter. Then some of the adverse effect of the common adverse effect of vancomycin infusion are nephrotoxicity and ototoxicity. In nephrotoxicity, there will be an elevated creatinine level. So when we are coming to the ototoxicity, there is a chance of vertigo, tinnitus, then hearing loss, and some kind of distractions, balance distractions the client might have. Another important point is that while administering vancomycin, it should be over at least 60 minutes. Because the faster rate of administration can cause more side effects. And moreover, we know that vancomycin is a vesicant, so while we are administering through a peripheral line, it may cause thrombophlebitis as well as extravasation or tissue necrosis. Usually the vancomycin administered through a central venous line, but there are certain cases when the therapy for a short-term purpose, it can be used with a peripheral line. Then the another thing, we said that while we are administering vancomycin, the patient should be connected with a cardiac monitor. So we can observe for the hypotension, because hypotension also an adverse effect of the vancomycin infusion. Then the another thing, that Redman syndrome. So what do you mean by Redman syndrome? So Redman syndrome is a non-allergic histamine reaction in which the client may develop the sudden onset of flushing or hypotension and macropapillar rashes over the face, chest, neck and the upper extremity. So that is called the Redman syndrome. Then the other thing that we should look for anaphylaxis like rash, pruritus, laryngeal edema, wheezing and all. So these are some of the main points while we are administering vancomycin. So now we will come back to the options. So the first option says that assess client for lethargy and decreased deep tendon reflexes. So what do you think? The lethargy and decreased deep tendon reflexes, these are some of the expected or some of the signs of hypermagnesemia. So that is not a thing that we should most appropriately assess for vancomycin infusion. So we can eliminate option 1. Then option 2, assess skin for flushing and red rash on face and torso. That we said that. So that is a correct option. Then infuse medication over at least 60 minutes. That is also correct. Then monitor blood pressure during infusion, because we said that one of the side effects is that hypotension. Then observe IV site for 30 minutes for pain, redness and swelling. It's a signs of thrombophlebitis. So this is the aspects related to vancomycin infusion. So what all are our answers? Option 2, 3, 4 and 5. Why the option 1 is not the answer? I already said that it is a signs of hypermagnesemia. So I hope it's clear to all. If you have any doubts, please mention in the comment box.